time has expired. Mr. Johnson.
Thank you, Mr. Chairman. Mr. Kavanaugh, the value-based purchasing program, which was enacted as part of Obamacare, is the federal government's most extensive effort yet to hold hospitals financially accountable for patient outcomes. Medicare compared hospitals on how faithfully they followed basic standards of care and how patients rated their experiences. In the first year of CMS value-based purchasing program, physician-owned hospitals demonstrated they thrive in delivering high-quality, low-cost care. Amazingly, 9 of the top 10 and 53 of the top 100 hospitals were physician-owned hospitals. CMS also recently released data that summarizes the utilization and payments for procedures and services provided to Medicare. Based on this release of information, we have now confirmed what many of us have known for some time, and that is that physician-owned hospitals are costing Medicare less than hospitals without physician ownership. And that doesn't consider all the cost savings associated with the higher quality of care they provide. The irony of all this is that the very law that created the hospital value-based purchasing program, Obamacare, bans the same hospitals this new accountability measure says are some of the very best in the country. Obamacare prohibits any new physician-owned hospitals from treating Medicare and Medicaid patients. This clearly discriminates against some of the most vulnerable patients in our health system. While the law permitted those physician-owned hospitals that received Medicare certification to be grandfathered under the law, it prevents these same hospitals from being able to expand to meet the access and quality demands in their community. This makes no sense, and it flies in the face of the administration's own benchmarks for quality of care and cost savings. Mr. Kavanaugh, do you stand by the results of the value-based purchasing program, which validates the quality of physician-owned hospitals?
Yes, the agency stands by the results of the value-based purchasing program.
Do you stand by the data released by CMS showing the cost differential between treating patients at physician-owned hospitals versus hospitals without any ownership by physicians?
I apologize, Congressman. I'm not familiar with those data, but I'm happy to look at them and review them. And
appreciate it if you would. I hope you all can support a bill that I've got out there, which H.R. 2027, which would establish a level playing field for physician-owned hospitals and ensure that patients will continue to have a choice in where they receive their health care.
Certainly, we look forward to reviewing that legislation.
Thank you, sir. Thank you, Mr. Chairman.